Hi there, my name is Rebecca and I'm an oncology, lymphatic and scar therapist, and I'd like to show you today some lymphatic drainage techniques for head and neck cancer. If you've had radiotherapy or surgery to the throat, the neck, the tongue, the esophagus, this is just going to help prevent you at risk of lymphedema if you've had those done, those treatments. So this just helps keep everything flowing, and if you do have lymphedema already, helps just to get things moving again, if you haven't gone to see a lymphedema physiotherapist yet. So first of all, you're going to empty the ducts, the lymphatic ducts, which are just above your collarbones here. You've got this little triangle here. I always find it easier to cross my hands over, and you're going to do 5 to 10 little on-off pressure there in that little triangle. Not too hard. Just taking some nice deep breaths with your belly, squeezing the lymphatics in your belly. Okay, this is probably going a little bit faster than you would do it, but then you're going to do some pumps. You've got a big muscle here called sternocleidomastoid, bit of a mouthful. So you're just going to do some little pumps over that muscle. Probably easier to do it on the opposite side. Starting at the top, sort of squeezing downwards, because this is going to drain into the space, okay? Squeezing down, squeezing down. Now you're going to get your fingers and go around your ears, hard with glasses on, but you're going to pump the front and the back of the ear. Open up the channels in there. 5 to 10 times. Okay, now you're going to pump in the mediastinal nodes in the middle of your chest here. I've got one hand on the other, so again, on, off pressure. Sort of little circles with it as well. Okay, and then go underneath the armpit. Squeeze. Squeezing the lymph nodes underneath the axilla or the armpit there. Okay, both sides. So 5 to 10 times, 10 if you've got time. Okay. Now you're going to start draining the area into the armpits first, and we're going to sort of work our way backwards. So first of all, you do a drag in pressure over your chest, under your collarbone, into the axilla. Okay. And bring it into the mediastinal nodes here. But we sort of want to encourage this lymph flow from the neck down into the axilla. This is easier to do without clothes on. So if you're doing this yourself, it's easier to get that skin drag straight on skin. Okay, so dragging down, pulling across from the back. Okay. Again, I'm going a bit faster than you normally would. Just a nice, slow, dragging sort of pressure. Okay, then you start on the neck. I go either side of the thorax here, just so you don't make yourself cough. Or you can drag it down and down like that. Do feel both. Okay, so the channels sort of come down from behind the ear, drain down into here. Do little sort of scoops with your hand and drag it down. But for good measure, if you just straight down too. Some of those channels come straight down. Okay, you're going to do little squeezes, get little pincer grips underneath the jaw here. Squeezing the lymph nodes underneath the jaw, and then you're going to squeeze those out again. So I'm using my sort of little paddles here. The thumb is going underneath there. Okay, little pumps behind the ear. Clear those little drains there, and dragging down. Every now and again doing a nice belly breath, squeezing the lymphatics in your tummy. Okay, so little pumps underneath the chin there. So if you've got any swelling over the face, you would drag around the face to the ear. You know, same as on the cheeks, drag it down, drag it across, and then to the ear and then down. So, but if you do have lymphedema or thickening of the tissue in the neck from the radiotherapy, you know, then you're going to spend a bit more time on the neck. Okay, find where it's thick, find where it's tight, little squeezy sort of pressure, okay? Gonna massage this area. After you've done the lymphatic drainage, clear the ears again, bring it down, clear these ducts here again. So that's the lymphatic drainage, clear and clear again, 2 or 3 times. If you've got any sort of radiotherapy, fibrosis or tissue thickening in the neck, then I'll probably get some cream. I like either, you know, this Mugu or QV. That's just what I like, but it's got some nice sort of consistency to it. So pop some cream on, and you're going to do a bit more of a sort of kneady massage. You know, massage the cream all around the back, underneath the head. You know, concentrating on those much thicker, tighter bits. Okay, massage all underneath the chin. Give it a good few minutes, okay? Fibrosis can be broken down and softened, but it does come back. You do have to do it at least a few times a week, but if it is quite tight, I'd be doing it every day to start with. You can do it even twice a day, morning and night. All right, so at the end, finish with your pumps again. Finish, pumps and pumps. Deep belly breath. Okay, so give that a go. That's just something you can do yourself at home if you haven't been to see a lymphedema physiotherapist or an oncology massage therapist like myself. That's just something you can do yourself to help prevent lymphedema, and if you've got lymphedema already and radiation fibrosis, that just helps keep everything moving and soft until you can get to see a professional to help you. Okay, thanks a lot, bye.